KCBS, in partnership with UCSF Health, presents As Prescribed, a weekly conversation with leading medical experts from UCSF Medical Center and UCSF Benioff Children's Hospitals.
Hello and welcome to As Prescribed. I'm Alice Wertz. Today we're talking about homelessness and older adults. Our guest today has spent years doing studies of homeless populations, recently doing in-depth interviews with adults experiencing homelessness in 8 regions around the state of California, representing urban, rural, and suburban areas. Our guest today is Dr. Margot Kushel. She's the division chief at the UCSF Center for Vulnerable Populations, as well as director of the Benioff Homelessness and Housing Initiative. Thank you so much for joining us today for this important topic.
Thanks for having me.
Yeah, so help us understand what's behind the headlines we're seeing lately about homelessness affecting older adults, those over 50.
Homelessness is really increasingly a story of homelessness among people 50 and older. Many of those 50 and older, even though they're in their 50s or early 60s, have health problems much more similar to people in their 70s and their 80s. And this has been a trend that started in the early 2000s and has just been accelerating. We did a study that we published in 2003 that showed that in San Francisco in the early 1990s, only 11% of adults experiencing homelessness were 50 and above. By 2003, 37% were, and I'm sorry, we published that in 2006. And now we just completed our California statewide study of people experiencing homelessness, which is a representative study of adults 18 and older living throughout the state. And we found that 48% of single homeless adults are now 50 and over.
Wow. We hear about homelessness with youth, but this is an incredible increase. Do you find that this post-pandemic has contributed to it?
You know, we found that that among homeless single adults, so this is really a different population than homeless youth who are really counted separately, considered separately, and a different population than what we call family homelessness or adults living with their kids. But the big bulk of people experiencing homelessness live as what's called single adults, meaning that they are over 25, they're not living with their kids, and that population is really an older population. When we did that study that we published in 2006, showing the alarming rise in people 50 and older, following that, a colleague at University of Pennsylvania, Dr. Dennis Culhane, did some research to show that, gosh, it was people born between 1955 and 1965 who are a giant population. They are the second half of the baby boom, who actually are the big bubble of people experiencing homelessness. We then started our longitudinal study in Oakland, meaning that we recruited 350 people in Oakland. They had to be 50 and older. They had to be homeless when they were admitted. And we have been following them ever since. And what we found that of those who were 50 and older and homeless, 44% had never been homeless, not even for one day before the age of 50. We then sort of thought, well, gosh, what is different about older adults who've been homeless for a long time versus those who are newly homeless after the age of 50? And indeed, they were quite different. The folks who were still homeless and had been homeless, in their 30s, 40s, they had life stories that were really tragic and really maybe confirmed the public's view of what it means to be homeless. These are folks who had really difficult childhoods. Life never really started off well. Lots of substance use problems and mental health problems. These often started early in their lives. Lots of involvement in the criminal legal system. Their lives just had never really gone well. And here they are in their 50s, still homeless. But the 44% who were first homeless after 50, their story was very different. These were people who were sort of working poor. They were generally working their whole lives, generally often more than one job. Their jobs were physically demanding, but low paid, without a lot of job protections. They didn't have pensions. They didn't have other things. And they really were hanging on every month, scraping by, barely able to make their rent. And sometime after the age of 50, something happened. And what was really interesting about these folks is they could kind of pinpoint the moment that things fell apart. Either they lost their job, their spouse or partner lost their job, their marriage broke up, their spouse or partner got sick, or they got sick, or their mom died, or their parent died, or their spouse or partner died. And they could say, I was sort of making it, barely, but making it. And then my wife lost her job, we fell behind in rent, or then my wife passed away and I her income and I was grief stricken. So it was a very different phenomenon. But what we learned is whether you became homeless first before you were 50 or first after you were 50, if you were 50 and older and homeless, your health is really poor. And we did all sorts of measurements of things that we know what we would expect in the general population. And the bottom line is that folks who were mainly in their early 50s, their health looked much more like we would expect people in their mid 70s to 80s in the general population.
Wow. So what should folks be aware of? Like, the Gen X, Y, and Z. Some cautionary tales you could share for those of us that are not yet approaching 50, but what matters as you prepare for your older adulthood in order to avoid home insecurity?
I think one thing that's important to point out is homelessness is not equal opportunity sort of oppression. That people who face other forms of structural oppression, people who live their lives confronting racism, Black folks, Indigenous folks, increasingly Latinx folks, are at much, much higher risk of homelessness. And that's partly because one of the things that protects you from homelessness is having intergenerational wealth, having other family members who have not only income but wealth, have the ability to lend you some money, have the ability to own their home and invite you in. And what we find is that we live in an economy that for years we've been cutting back, right? Income inequality has risen incredibly. That what the working poor now make is much less compared to the expenses that they face than was true in the early 70s. That we have been cutting back on things like pensions. And so that people really don't have those support, and that homelessness happens to people who are scraping by and who don't have intergenerational wealth. I think there's this myth out there that everyone is homeless because they no longer have friends or family. And if we could just, connect them, it would all be fine. And that really elides what the true story is here, that homelessness is mostly happening in communities of color. And what we found through our research is that most of the folks who are homeless, particularly those from those communities, were in fact connected to their families and friends who loved them, who wanted to protect them. But those families and friends were facing the same uphill factors as renters and not homeowners. They didn't have the same ability to welcome somebody else into their house. They too were struggling to make their rent, to pay for food. Money was tight. And so what you see is that people might move in with family or friends, but it's unsustainable because it's overcrowded, because there's fear that the whole household will be evicted, because they don't really have renter protections, and it's a lease violation to bring someone into your home who isn't on the lease, and that things fall apart. So I think we need to be clear-eyed about what we're seeing as the problem. And I think that will lead us to the solutions.
What about policy? Do you have any hopes? We could talk about this for a long time, but what is your hope in regards to how do we change policies or work with legislators, or because we've got the largest segment of the population advancing into their third phase of life, the baby boomers. And I'm hearing you're saying these are very, very vulnerable folks.
Yeah, I have been pleased at the response to our work in certain policy circles. I think that there is something that really hits people in the gut about older adults being homeless in the same way as children being homeless. Nobody should experience homelessness, but there's something about a child experiencing homelessness or an older adult experiencing homelessness that really drives home how horrendous this is. I think the point for the viewers is that the policy changes that are needed are deep. Right now in California, we have only 24 units of housing that's affordable and available for every 100 extremely low-income households. That this is a deep structural deficit. We are short, just in California, 1 million units of housing that low-income households can afford. We've made some progress. We were at 21 per 100 and we're up to 24, but we're obviously far from where we need to be. And that all routes to ending this crisis flow through housing, and specifically housing that is affordable to the lowest income households. Anything that we can do to increase incomes of extremely low income households, whether that is through reforms of pension, reforms of benefits for people with disabilities, increasing the minimum wage, increasing access to job pathways, that's going to help a lot. But the other thing that we desperately need is to increase our supply of housing and the funding for it, the subsidies for it, to make that housing accessible to extremely low-income households. That is how we solve this problem. That's what we're trying to get policymakers aligned with. And we recognize that we're going to need help from all sectors. We have quite a lot of buy-in from local and state elected officials. And what we really need to push for is that buy-in federally, who actually have the ability to put the funds towards this problem that the problem requires.
Yeah, there's a long ways to go, but I feel confident having folks like you, Dr. Kushel, behind the solutions and talking to the policymakers that there is good opportunity for California to move forward and set a model that can be scalable for the country. We really appreciate you joining us today.
Thanks for having me.
Our guest today is Dr. Margot Kushel. She's the division chief at the UCSF Center for Vulnerable Populations, as well as director of the Benioff Homelessness and Housing Initiative. Thank you for tuning in to As Prescribed. I'm Alice Wertz.
As Prescribed, every Thursday at 1:30, right here on the Bay Area's news station, All News 106.9 and AM 740 KCBS, and streaming on the Odyssey app. The proceeding was sponsored by UCSF.